Hi, everyone, and welcome back to Stories for Hope podcast. I'm your host, Nicole, and in today's episode, we're going to hear from Amy Parkhill, a professor from St. John Fisher College, about the impact she's seen in Guatemala and in her students through the various medical outreaches they've done over the years. For those of you who are new, Stories for Hope is a podcast run by Hope for Kids International. On this podcast, we share inspirational stories to inspire you to bring hope to those in need. If you remember hearing about our 4 pillars of hope, one of them is health. Since 2017, Amy has invited groups of her students to come serve at medical outreaches in Guatemala and apply the skills they've been learning to real-world situations. Let's jump right in and hear from Amy.
So I had been on service or medical mission trips with a previous organization, and I was just looking for other opportunities for a trip to Central America that I could take the students on that had a medical focus. So I was just Googling, and I think I Googled like service, medical mission, Central America or something, and Hope for Kids came up. So then I read through the whole website. And I was like, yeah, I think that this could definitely work. And I sent Amy a giant list of questions. And I was kind of like, well, I don't know, because I had done this with other organizations too. And I wasn't sure if she would get back to me right away or if at all, because some organizations didn't get back to me. But of course, Amy got back to me right away with very thorough answers to every single one of my little nitty gritty questions. So we just kept in contact. I kept on asking her more questions, and then I was like, I think this could really work out well. So that's how I got involved, and that was in the fall of 2016. But that following summer, 2017, was when our first trip to Guatemala was. Um, the medical clinics were somewhat similar to previous trips that I've been on, but on a smaller scale. Because previous trips I've been on, it was like you set up shop in one area and you were there like all week, and then just more and more people came in as the week progressed. This one that was three to four separate medical outreaches, so you're just in one area for just one day. Um, but in a smaller number of patients came through. Um, so I think in those first trips, we definitely, depending on where we were, we did see a lot of needs. And sometimes those needs were things that we would definitely take for granted, like definitely vitamins and over-the-counter medications, Tylenol, and ibuprofen and Tums and things like that. And then also, I think in the beginning there we noticed a lot of more like upper respiratory infections that needed antibiotics and stuff like that. And as we've progressed throughout the years, I've noticed fewer and fewer prescriptions for antibiotics. So I feel like at least in some of the communities that Hope for Kids like has on child sponsorship, that the kids are having their needs met better and that they're not getting as sick as they were in some of the previous outreaches. And it also is really helpful. We have Dr. Maria Luisa, that is the in-country doctor. So I think she is able to, give us some insight about like what's going on in community and how medicine is practiced there as well. So that has definitely been very helpful on all of the trips. And that isn't also something that I've seen on all of the medical trips that I've been on in the past, that they have that in-country doctor to provide that perspective. And I think that that's really useful and helpful also to the patients themselves, that they know that it's not just Americans coming in and saying, "Oh, you have to do it this way." There's someone that has that perspective of of the culture and how things operate within Guatemala that is allowed to give us like medical advice too. So I think that's really, really useful. Well, all of the places that we go, there is somebody there that is year round. So either it's Pastor Neri and his entire family, or Gabo and Sylvia, David Beam, or Cindy and Joe. So I feel like that's really important because there is somebody there that's able to support those communities throughout the year. But I think the most drastic difference is the first year that we went on the trip was 2017, and Hope for Kids did not yet have a child sponsorship program in Escuintla. But then seeing the needs of Pastor Neri and the community in Escuintla, that was developed. So then the very next year that we went, we saw that the kids they were a lot healthier. Like, I think the first year there was a lot of kids that had different rashes and looked not very well nourished, and they were a little bit wilder, I guess you would say. And that next year it was a very drastic difference. The kids looked healthier, and they were so polite and respectful. And now each year it's like better and better. And there's new kids coming in, so it just kind of you see like the kids, the newer kids coming in, and then the older kids are there, and they're kind of helping out the younger kids, and they're helping out Pastor Neri and his family, and I really love to see that. So like, one of the children that I remember, so early on, the first year that there's a child sponsorship program, a group of my students sponsored one boy, and he had a heart condition, and they sponsored him, and now he's 16-year-old, taller than me, teenager, and he looks like he's great. He's doing really, really well. So I think that is the most drastic change I've seen is in the kids in Escuintla, because we see them and they remember us too. Like, they remember me from year to year, and so I love that, and they're just getting better and better. So that's really, really great to see. Almost every interaction is a little bit of inspiration. So, yeah, sometimes the stories are hard. We know that like we can't provide everything that that patient needs. Um, but I think, and I mentioned this during family time, like, but we can take the story, that patient's story, and learn from their experiences, and we can be different because of what we've learned about that patient. Because sometimes the stories are heart wrenching, and we might not be able to do as much as we would like, but maybe we can do more for the next patient because we've learned from the first, or we've been impacted by it, or now I'm going to be kinder or more empathetic to patients that are in similar situations. So even though like they might not be able to fix everything for that patient, like they can make a difference by just being there and providing like, you know, simple medications to them, but also like giving them the dignity, like showing like, okay, you are important. We have these doctors, nurses, pharmacy students, pharmacists that are coming, and they want to help you. So I've love when like patients get reading glasses and their faces just light up because now they can see. Like they'll say that like, oh, now I can see, and they sometimes have tears in their eyes because they're just so happy. And in those cases, I want to give them like 5 pairs of reading glasses in every color that we have. Um, so that's, definitely inspiring. I mean, I think, sometimes there has been some, very serious medical challenges that patients have had. And um, I like to see that like Hope for Kids, continues monitoring those individuals and providing support, um, or will rush out and get medication. We might not have it there during the clinic, but if somebody needs something, then I've seen where we've, you know, had sent out some of the drivers, and they've went and got the medication, or it was arranged the driver will go back to that for that patient the following week or a couple days later and bring them to the medical provider that they need. Um, so that's definitely inspiring, and I think, I mean, the biggest source of inspiration is that really my students, that they all want to come back. They all want to continue to do trips like this and serve their community. And I see that some of the students now come back to Rochester, which definitely has some needs, and then they want to go out and serve people in Rochester that have, some, not, I wouldn't say exactly the same challenges, but similar challenges to some of the patients they've seen in Guatemala, so that they really have a heart for serving those that really need the help, and they don't want to just be comfortable in their suburban pharmacies. They want to go out there and really help those that need it the most.
Thank you so much, Amy. Medical outreaches are so incredible, and health is a vital part of restoring hope and helping communities break the cycle of poverty. I love how Amy talked about how the success comes from everyone coming together to serve. Our ministry partners in Guatemala provide around-the-clock care for all our sponsored kids and their families. Then you combine that with our child sponsorship program, where part of sponsors' monthly donations provide daily nutritious meals for the kids. Then combine that with medical professionals and students coming to help with routine checkups, address more serious issues, and work alongside the local doctors to gain a wider worldview of medical needs. And then in turn, the local doctors learn new ways to treat and provide care for their local communities. Then those students are inspired to serve in their local community, serve in other communities around the world, or continue serving in Guatemala. And then the children in our sponsorship program grow up healthy and get to dream and hope and have a brighter future. You've got multiple ripple effects all happening from a medical outreach. I've got goosebumps just thinking about all that. If this has inspired you to want to get involved, maybe you want to travel with us and serve on a medical outreach. Maybe you want to sponsor a child and help them with their education and provide that daily nutritious meal. We'd love to hear from you. You can get connected with us by going to h4ki.org. Thanks again for joining us as we continue to share inspiring stories. Have a blessed day, everyone.